And welcome to Skin Sense here on SSP TV and SSPTV.com. We're here and we can make fun of Dr. Schleicher because he's not with us. It's Zach and me on the show, right?
I'm stepping up to the plate.
You're stepping up to the plate. So Zach Sabaday is with us. What's your title here?
I'm a physician assistant, mainly in charge of clinical research trials that we run.
And that's what we're doing today, talking about another trial that's going on. And the DermDox Center actually is one of only a few people, I should say, in the world that deals with these trials, right?
That's true, yes. There's not many centers like we have, so we're able to run phase 1 through phase 3 clinical trials. That means we're covering trials that are first in human all the way down to ones that are about to be released on the market.
Right, so the things that you guys cover we're actually using in everyday life in medicine.
Correct.
That's pretty astounding, right?
Absolutely, I think it's really exciting.
Yeah, so today we are talking about a trial on HS, and I'll let Zach tell you what HS stands for.
Yeah, because it's a very long word, and a lot of times people don't remember it anyway, but it's Hidradenitis suppurativa. And
who comes up with these? What does that stand for?
Spelling bee word, that's what it is.
Yes.
So it means this condition that causes a lot of inflammation underneath the surface of the skin, mainly where there's hair-bearing areas or sweat glands.
Okay.
So
that's what we're talking about today. So what is the trial? What are we looking for in the trial as far as who does this usually, I should say, attack really? Like, is it a male, female, a certain race?
Mainly it affects females.
Okay.
It also affects African Americans at a higher rate than Caucasians or Asians. And also it does have some bias towards smokers as well.
Oh, okay.
It happens mainly
age?
in adolescence.
Oh, in adolescence.
Yep, so when your oil glands start to produce more oil, sebum production around that age, that's when this usually shows up.
Okay, so HS, I know we have a couple pictures. Are they bumps that people usually try to squeeze? Are they, what I'm saying? Like, what are we dealing with?
So we're dealing with these bumps or painful nodules underneath the surface of the skin that you might go to the ER for because it is very painful. Sometimes they'll spontaneously burst on their own, through mechanical movements, walking, raising your hand in class, things like that. It doesn't take much. If there's a lot of, inflammation under the skin and there's a lot of pus as well, it's got to go somewhere. So, yeah, it's very unfortunate, and a lot of people do feel a lot of shame because of that. And it's nothing that these people are doing. It's not that, a lot of people get teased that they're not showering correctly or they just don't take care of themselves, but that's not it at all. It's a systemic autoimmune condition where the body's immune system is just overactive.
And it's not something that you should try to pop?
Not something that you should try to pop on your own. Always let a medical professional do that because you don't want to introduce infection into the area.
Okay, so if someone's at home and they don't even know if they have HS, what are the things they should look for? Obviously, they should be seen by a medical expert like DermDox.
Absolutely, come on into DermDox if you're, experiencing these nodules, painful bumps or lumps. Females sometimes get it under the breasts, usually under the arms, in the groin area as well. Those are the common areas to get this condition. It's not going to be something that you're, getting on your forehead or something like that.
So anywhere there's hair, can they get them on their head?
No, that would be more of a folliculitis on your scalp or on your head, but there are people who do have it more systemically, dispersed on their body, just not generally on the face.
Okay, so men, even with a beard, they wouldn't get it on their face?
Not as much. No.
Okay. So if you think you're a candidate, who are we looking for? What does the trial look like? What are we looking for?
So we're looking for anybody above the age of 18 who has this condition and has tried other medical therapies for it. Usually they put patients on something like an antibiotic and some topical antimicrobial treatments to start. If they failed those and they're not helping the patients anymore and they need something a little bit stronger, then a great opportunity would be to come in and see us so that we can, get us screened for the trial and see, hey, maybe this will be the medication that works.
How do you guys decide what trials to do? Is it something that companies connect with DermDox, or how do we get to this point of doing the trials?
So we get to this point by partnering with our parent company, which is Vial, and they get these studies handed to them, and they basically tell us, these are the studies available right now, and we decide whether it's something that we can do at our facilities, and if we have the right patient population for it.
Okay. And then the studies are something that can take some time.
Absolutely. They can take a year, 2 years, but you're not tied down to it. It's not like a ball and chain. You can withdraw your participation at any given time. You just say the words and you're done.
Right. Okay, so it talks about here on the sheet that we have that there's 3 key questions to ask if your patient is, if you think they're a suspect for HS.
Absolutely.
So types of lesions?
So nodules, painful bumps, lumps under the skin, boils are what they're usually called too.
Okay, the location of lesion?
Location, armpits, groin, main areas, under the breast for women.
Okay, and the lesions of how chronically they have them?
Right, so if it happens once in your lifetime, it's probably not HS. If it happens twice, 3 times, we're borderline. If it's something that's, recurrently happening here, every so many months, then we're thinking it's probably HS.
Okay, now you said in the beginning that this could happen mostly in teenagers.
Yes, at the age of adolescence when they're going through puberty.
Okay, so that is a good point to make. So mom or guardian or parent should actually talk to their children, right, about the hygiene and stuff. But those are areas you're not necessarily looking at when your kid's a teenager.
Right.
So how do we get through to them to say, listen, we need to get this checked out? Teenagers are very private,
yes. So, this is something that they deal with for a while before it ever comes to fruition where they get it treated. I've seen that a lot in my own private practice where the patients just won't come in until it's a major issue.
Right. So talk to your children about, if they have any marks or pain or aches that you should know about, just especially under the armpits. At least that's an area that they'll kind of let you look at, and to see if it's something that should be treated by a medical profession.
Absolutely. I would say talk to your kids about it. Tell them there's no reason to feel any shame towards any of these things. Our bodies are all going through these changes, and some people will get a condition like this, HS, and this will be when it appears, so it's better to handle it now than to let things get out of control.
All right, we're going to take a quick break, and when we come back, we will continue telling you the who, what, when, where, and why with HS of the trial that we're doing, and we're looking for patients to come in, be a part of the trial, right? They can get paid for it.
That's right.
And we'll give you all the details when we come right back. You're watching Skin Sense right here on SSP TV and SSPTV.com. Welcome back. You're watching Skin Sense here on SSP TV and SSPTV.com. I'm your host, Jeannine Lesante George. I recently got married. How about that one?
Oh my goodness, you did?
I know, I did. So I got a new last name on there.
All right. What's the last name?
George.
Oh.
Very easy. George. Very easy. And I'm very excited because Doc is in here today, so we can pick on him.
That's a perfect opportunity.
It's just me and you. So, Doc, if you're watching, this is going to be the highly rated show of the 25 plus years we've been doing it, because Zach's on and you're not here. Hope you're having a blast wherever you're at. We are talking about a trial today, right?
Yes, we're talking about a trial that we're going to be hosting very soon here. So if we have any patients interested who do have hidradenitis suppurativa or HS, we are offering this trial, and if you've never, received a treatment that has done anything significantly effective for you, this is a great opportunity to try something new.
And it's also free because medication's expensive.
Absolutely.
So at least you get to be part of a trial with people who could have the same condition you have. It's an embarrassing kind of very personal disease, I would say, or that they have, and it could be treated. There's only a couple treatments though for this, right? Right now?
There's not many things on the market to treat this. So the only FDA approved medications that are on our market are Humira and soon to be Cosentyx. Both are biologics and they work for about 50% of patients, but neither are, foolproof. We want to get something that's a little bit more effective.
And are they safe for teenagers?
So it is safe for teenagers. Depending on the severity of their disease, it's not the first thing that I would jump to, but if we have a very severe case of HS, then yeah, I would say this would be the option to go with.
And if it's the same kind of skin condition, why would it only work on some and not others? Do we know?
So
just
genetics,
how the body is?
Yeah,
genetics. Okay.
Genetics play a big role. Also, a lot to do with the diet and lifestyle habits. Smoking is a big one.
Okay. So let's talk about more about the stages of how HS develops.
Okay, absolutely. So usually when HS develops, it's occurring underneath the surface of the skin, so it's not going to be, blaring in your face like something is wrong. You might start to notice a couple little red bumps, boils, a little bit of pain in those areas as well, and then you'll notice them kind of recurring in those same areas over and over again. And it'll get to the point where they get larger and larger, and they could even tunnel or make these sinus tracts under the surface of the skin where they connect, and pushing on one area may cause expression of the pus and the contents on another site.
It sounds painful just you describing it. So if this happens, first of all, if it's a teenager, please tell an adult so that you can get treated. It's not just a normal pimple. It's something that should be treated if it's painful, and like you said, you keep having these reoccurring bumps that have large pus in them and
Absolutely.
that are painful, right?
Yeah, absolutely, and that could inhibit your activities of daily life, and if they're inhibiting them significantly and they're causing you to have difficulty with movement, walking, even raising your hand in class, then yeah, absolutely, I would say that's when it's time to definitely get treated for it, because you don't have to live like that.
Now, when you come in, there are treatments to actually have some relief that you do in the office.
Absolutely, there are treatments that we do in the office, and they would involve things like steroid injections. We can give you a little bit of steroid to kind of calm down the inflammation. We can do what's called de-roofing of these nodules, where we take a scalpel and basically, like taking the lid off a tea kettle, we let the contents come out and let it kind of heal on its own afterwards.
So what's the difference when you do it as opposed to, are they making it worse by irritating and like squeezing the cyst themselves? Like what makes it, are you getting like to the root of the area? Like are you taking out a pouch or something? Or
so there is no pouch with it. That would be nice if there was a little pouch. But in the doctor's office, it's much more sterile. We can clean the area, we can express it greater than you probably could yourself. When you're working on yourself, you only have about one hand that you're able to really work with. So I wouldn't recommend that. I would recommend coming in to see a professional, see your provider, get treated for it in the office, where they can do things like control bleeding if they need to and clean the area. Okay,
and then does that mean that they need stitches afterwards, or how do you handle that?
So depending on where this area is, if it's something that's visible, like further down the arm, we could give you stitches for it, but generally we like to leave them open so that they kind of scar over, and those areas that are prone to getting those sinus tracts and tunneling can scar and not recur.
Oh, okay. So once they scar, it's almost like you're killing what can grow in there?
Kind of, because any of these tunnels, anything that's recovered is just an opportunity for it to tunnel again.
Got it. So you're blocking the tunnel. All right, so the study, if people are interested, how long is the study? Do we have specifics on that yet?
So it should be at least a year. like I said, your participation, your consent to be in the study is totally voluntary, so you can withdraw that at any time. I can't reinforce that enough. You're not tied down to us, but we do love to have you as long as you're willing to be part of the trial.
And it's all confidential. It's not like they have to be on TV saying, hi, I'm part of this trial. It's confidential.
Completely confidential, covered by HIPAA, so you'll sign a HIPAA contract with us. And
HIPAA means that everything on there is private. It's patient confidentiality.
That's right.
So if you want to be a part of the study or think that you might be able to be a part of the study, they call, they come in, they meet with you for a consultation to see if they can be a part of the study.
Right. We make sure that we actually have HS.
Yeah.
And not just some pimples.
Well, that's another thing you could diagnose if it's on HS. It could be something, it could be acne, it could be treated with other things. So at least you're getting in here to the dermatologist.
Yeah, to get that cleared up. Because a lot of people, you never know. It could be something totally different.
Than what you think it is.
Yeah.
Cool. So then they come in, they go through the study. Now they could be placed on a placebo, correct?
That's true. So that's the caveat. You know, you sign up to be part of this clinical trial and you receive placebo. You're still getting paid to come in and you're still contributing to the science of figuring out whether this medication is effective. So you're still doing your part and you're still playing a huge role. Unfortunately, you're not getting the real med, but there is a chance that we go into an open label extension portion of the study. Now, we don't know if we're going to have that yet, but if we get an open label extension, that means that the label's off, it's showing you it's real med, and
Then
you're getting
everyone
treated.
gets it.
Yeah.
Got it. And how many people are you looking for?
So we're looking for as many people as we can get in this study. It would be wonderful if we could get 10, but this isn't a very common condition, so it is a little bit harder to find the patients.
For your other trials, because you do many, many trials over the years, what is the standard of how many people, what is the minimum you need to do a study?
Minimum, like 1 patient.
Oh,
Yeah.
really?
Yep, because some conditions are so rare
Oh,
that
okay.
it's hard to find patients. Some conditions are only for a certain age group, and it's hard to find, you know, somebody who's an adolescent who has this condition.
Right.
So
But then like something like eczema, you might get like,
we might get 40, 50.
so you'll take as many as possible of anyone who has the condition who wants to be part of the trial.
As long as, you know,
They
we have the
qualify.
facilities to do that and they qualify, then yes, absolutely.
And how often do they have to come in for this study?
Generally, I say we come in and see us about once a month. In the beginning, it's usually a little bit more.
Yeah.
So you might come in 1 week, the next week, then 2 weeks from then, and then we get into a monthly visit.
That's not bad.
Not bad at all.
And then the payment is based on,
Payment is based on what occurs at each visit. So if we do blood work at one visit, usually we pay a little bit more. If we do, you know, blood work, let's see, an EKG and other assessments, then we pay a little bit more
and
depending
they
on.
don't have to pay for anything. No copay to come in, nothing for the medical.
No
nothing.
copay, nothing goes through your insurance. You don't pay anything up front at the desk. It's completely covered.
Yeah, it's like you're helping them and they're helping you.
Right.
And then hopefully there'll be a new medicine that comes out to treat this.
Fingers crossed,
That's-
because the
that's-
current things on the market aren't really
Only
doing the
help
job.
50%. 52% of patients with HS experience disease progression in one or more regions within 2 years. That's not really good. That rate isn't that good. We want to get that up to at least 80-85%, right?
Yeah, we want to see our patients improve dramatically. We don't want to see any 50%. If we could do a lot better than that, that's what we strive for.
Very good, very good. Anything else you want to mention about HS or any of the other trials that you do for people to know?
Just if you're questioning whether you have HS or you don't have HS and you're kind of, you know, on the fence about it, come on in and see us. We'll see you. Again, it doesn't cost you anything. It's a screening visit, so if we qualify, great. And, you know, if you want to do the study, even better. If you qualify and you don't want to do the study,
It's up
Great.
to you.
I mean-
there's no obligation.
yeah, no obligation.
What are your locations that people can visit
So
for this study?
For our clinical research, you can visit the Sugarloaf office. You can also visit the Camp Hill office. And Camp Hill is offering the phase 1 trials as well.
Okay, cool. So you can call here if you're local to this area or local to Camp Hill.
That's right.
Why not?
Yeah.
All right, you
Come
want-
on in and see us.
You want to make fun of Doc at all before we leave?
Oh,
Or
absolutely. He's enjoying Miami and the sun, and
You called
He
him
left
right
us
out.
here.
You called him right out. He left us here in the fall. Well, it is a beautiful day in fall.
It is a beautiful
Now it's a beautiful
day.
time of year, the fall foliage and beautiful trees, but then it's going to rain, and then whoever likes winter sports, be happy because they're coming up, right?
I'm not a winter sports person.
No?
I'm not a winter person at all, so
We'll have to get to Florida and get Doc back working.
I think that's a great idea. Let's get down to Florida as soon as possible.
That's right, that's right. Doc, you're on your own for the next show, but if our viewers have any questions, again, you can call DermDox here in the Sugarloaf location or the Camp Hill location. And if there are any other questions you have medically, anything to do with the skin, check
I'm
them
your
out.
guy.
He's your guy. Zach's your guy. Doc Schleicher's out. Zach's in. We'll see you next time right here on Skin Sense.